Next company out is MediTuner, CEO Henrik Ljungberg, who will talk about the Asthma Tuner, a self-management app for asthma. And I don't know if you know this, but I was one of the 7 founders of Aerocrine, which we started here at the Karolinska we applied for our first patent back in 1991. We took the company public maybe almost 10 years later, and it was sold for 1.5 billion kroner last summer. So it's especially welcome to an asthma fellow, inventor, entrepreneur.
Well, great to hear that as an example. Well, thank you for inviting me to speak here this afternoon. My name is Henrik Ljungberg, and I'm here to present our company MediTuner. I'm the founder, together with a colleague. Our first product is Asthma Tuner. I'd just briefly like to describe it. Asthma, there are lots of drugs available, inhalers and medications for asthma. And the problem is that asthma is a variable condition. And that means that some days patients have to take a lot of medications because it's worse, because there's pollen outside or something. And other days they have to take less medication. And we're basically asking the patients to be their own doctors to decide how much medication of all these inhalers that have been prescribed should I take today. And especially this is difficult for parents, of course. My background is in pediatrics, and we see that we are basically asking the parents of our patients to treat their children. Now, how should you treat asthma? Well, it's simple for those who know this, of course. This is not supposed to be so large that you can read all the little text, but it's basically you have several steps. So you increase your medication if you're worse, and you reduce your medication if you're better. So every step is basically add on an inhaler or a medication. And what determines how you should step up or step down to treat asthma, which could be done on a daily basis for some patients? Well, it's lung function. So we have a spirometer which measures lung function, and it's connected to a smartphone with the means of Bluetooth. So the patient expires into the spirometer and answers 4 simple symptom questions. And in the next, when they swipe on in the app, they will get a picture of their inhaler and how many of inhalation or whatever medication they're on that they should take. Special hello to Astra, of course, if you're here. Of course, there is a back-end service or a web-based healthcare interface whereby the doctor or the treating physician or asthma nurse can see the results, how their patients have been doing, and so on. Main advantages of this is that, of course, the patients get a good idea of what medication they should treat, so they're not so insecure about it. So we expect patients to be more compliant to the treatment. And for the doctors, it's a powerful diagnostic tool as well as a great time-saving tool, because you can very easily, using the system, make a personalized treatment plan for each patient that you have. And it's something that you should do for every patient that you have. So what are the revenue streams in this? Well, of course, they're at all levels. Depending on the geographical market, this will vary. But in Sweden, for example, the main revenue or main income will be from licensing software to the healthcare system. How far along are we? We're in our first clinical evaluation, and it's approved by the Swedish Medical Products Agency. And we're including patients from our clinic here at Karolinska, as well as in the GPs and vårdcentral around Stockholm, and we're looking at measures of asthma control, quality of life, and health economy, of course. It's a unique system in that it's the first system for asthma to connect the patient to their healthcare providers and actually give a concrete treatment recommendation. And it's also unique enough to win us this prize, the City of Stockholm Innovation Scholarship in December. And of course, there's a huge market potential with asthma being very common. Almost 10% of the population have asthma. So the aim of our company, MediTuner, is to provide the best systems for diagnosing, self-managing, monitoring, and patient education in asthma and other respiratory conditions. And we are here looking for investors, licensing, and distribution partners at this stage. I also like to take the opportunity to thank these organizations who have so far helped us along to develop this product. Thank you.